everybody, I am Agraj and I welcome you on my official YouTube channel. Now this video will be based upon the comparison between MBBS and other medical courses. So let's start the discussion. As you come to know that there are different medical courses available in our country. Out of that, MBBS is given first preference, or you can say that the MBBS is actually the aim of each and every NEET aspirant, but due to the personal and family issues we can't able to grab government medical seat for MBBS, and hence we actually move for the other medical courses. So this video will be all about the rest of the medical courses rather than MBBS, and we are going to discuss on these topics. So let's start. If I talk about medical field, so it is vast. It composed of different courses, and these courses are first MBBS, second BDS, third BAMS, fourth BHMS, fifth veterinary, and sixth BSc nursing. So there are 6 important branches into which you can say the medical science have been divided. Now out of these 6 courses, MBBS is given a primary preference in our society. But as I had already told you earlier, that due to some reasons which may be either personal, public or family reasons, we can't able to crack NEET with good marks, hence we actually fail to do MBBS. Now there is a huge problem nowadays that most of the student belongs from middle class family in our country. Therefore they can't able to spend little money also on affording private medical colleges, because if I talk about MBBS, so as you know that the fees of MBBS is even high in government colleges, but these fees can be affordable for the middle class family. Okay, but if I talk about the private medical colleges or semi government medical colleges, there is a huge fee difference. Therefore I can say that we middle class citizens can't able to pay such huge amount. Hence most of the student, in spite of taking drop, go for doing the other medical courses, because if you are already a dropper but you can't able to crack NEET exam, then you will move for doing other medical courses like BAMS, BHMS, veterinary, BSc nursing, etc. Now this video is all about comparison between MBBS and BAMS. Also in the same video we will discuss in detail about what are the future scopes for a student if he or she do BAMS in his or her life. So let's start now. If I talk about MBBS and BAMS, so let's start one by one. We will study difference. MBBS is based upon the modern techniques, or on the techniques which have been developed by the man in this century or a century before. If I talk about BAMS, so BAMS, as the name suggests, based upon the primitive techniques that have been developed in our country India, and BAMS exclusively depends upon Ayurveda and use the Ayurvedic tactics in order to treat patient. If I talk about MBBS based upon the allopathy, or it depends upon the medicines made up of modern chemicals. Now you know that the society always treat MBBS superior as compared to BAMS. I will talk about that in next part of this video, but till now this is a video which will actually tell you the difference between MBBS and BAMS and future scope for BAMS. So as I had already told you, first point, MBBS and BAMS are different. MBBS is actually a modern science and BAMS is primitive science. MBBS is universal degree, that is, it is accepted by any people living in any part of the world. But if I talk about BAMS is a special medical profession which is exclusively found in countries like India, because Ayurveda and origin of Ayurveda, these all the things have taken place in our Vedic civilization, and Vedic civilization, that is Harappan civilization, have been actually arisen in Indus Valley, and hence it is called Indus Valley civilization, and it is actually the history can be seen only in case of our country India, and hence the BAMS doctors are not found all over the world. MBBS doctors are found all over worldwide. Next point, MBBS is a professional degree. In the same way BAMS is also a professional degree. Now you have to remember that if you do MD in MBBS, then you have too much scope in your life. In BAMS, most of the people think that there is no any scope after doing MB also in BAMS, but it's absolutely wrong. You have too many earning options in BAMS also. Now it depends upon you that from which point of view are you thinking about. Each and every course is good, each and every course has its own beauty, therefore you cannot differentiate between MBBS and BAMS. Obviously society treats MBBS as a superior degree than BAMS, but the decision of making any degree inferior or superior depends upon your mind. You don't listen others, please. If your parent is telling that it is necessary for you to do MBBS and not BMS, then it's right, because you have to obey your parents. But if you are changing your decision by hearing or listening the opinions of other peoples which are also your friends, then it is not necessary for you to listen them. Okay, it's depend upon you. If your mind is telling that BAMS is a good course, that is, if suppose you fail to got government medical seat in MBBS, then BAMS is a very right choice. Don't move for BDS. Now I am actually not making BDS fun. Obviously BDS is also a very right option, but according to me, I respect both the fields, BDS as well as BAMS, but my mind tells me that if you don't got MBBS, then you will move for BAMS. It's my experience. So obviously please keep this topic aside. First we will cover the difference between MBBS and BAMS, then we will discuss about future course of BAMS. So let's start. So you come to know that MBBS is a modern science and it has been developed in century before and in this century, but the BAMS have been developed many years before. And you come to know that the origin of BAMS, you can say, is found in the Harappan civilization, that is in the Vedic civilization or Indus Valley civilization or Sindhu Valley civilization. Now you must have to remember that if I talk about MBBS doctors, then they give allopathy treatment to the patient. If I talk about BAMS doctor, then they give Ayurvedic medicines to the patient. Now as you come to know that nowadays we all humans are not understanding the beauty of our natural science, but we move for eating chemicals. Now you come to know that most of the people like to take allopathy tablet, because allopathy tablet have a fast mode of action, they work quickly and give quick relief to the patient. But if I talk about Ayurvedic medicines, so these are actually the slow working, but once you actually take a full dose and treatment of Ayurvedic medicines from many years, then you can remove that particular disease from the body permanently. And most beautiful thing about Ayurveda is that Ayurvedic medicines actually doesn't cause any harm to any part of your body, and your internal organs actually work properly and they do not face any difficulty. That is the meaning of my sentence, that Ayurvedic medicines doesn't involve with the functioning of internal organ. They do not kill useful cells or they do not cause harm to our body. But if I talk about allopathic medicines, as they are made up of chemicals, so they also cause few or more percentage of side effect in your body. Okay, so it's very important. But as you know that nowadays people like to get relief from any disease quickly, therefore they move for allopathy first, then they understand after some years of taking allopathic treatment that allopathy is damaging our body, and hence they move for the Ayurvedic medicines. It's very important. So as I had already told you that Ayurvedic medicines are slow working, but once you take their full dose, then you can get relief automatically from each and every disease. And most important beautiful thing about Ayurvedic disease is that Ayurvedic disease does not cause any harmful disease, or Ayurvedic tablets are very useful and they are not responsible for damaging of any of your body part or body organ. So you can trust on Ayurvedic medicines. But yes, for getting relief, it is necessary for you to complete the whole course of Ayurveda. And yes, I can say that mode of action for Ayurvedic medicine is slightly more as compared to the mode of action for the allopathic medicine. I will relate both allopathic medicines and Ayurvedic medicines by taking a very interesting example, and you know that particular example. Have you heard of two particular chemicals, neurotransmitters and hormones? You have read that in the chapter hormonal system or endocrine system. It is the last chapter of your 11th class. So you come to know the mode of action for neurotransmitter is very fast. They work in a fraction of second. But if I talk about their effect, then their effect is short lasting. It doesn't exist for more time. If I talk about hormones, so their effect is prolonged and they are long lasting. Are you getting my point? Hormones obviously work slow, but their effect is long lasting. Here is if I talk about the neurotransmitter, their effect is short lasting because their mode of action is very fast. So I can say that Ayurvedic medicines can be related to the hormones which work slowly, but once they started to work, they actually provide you 100% relief from any disease or disorder from which you are suffer from. If I talk about allopathic medicines, so these are comparable with your neurotransmitter which easily act upon body cells, but they have a short lasting effect, that is you have to take them on regular basis till your death. But the very beautiful thing about Ayurveda is that you can treat the complete disease from its root, and you can even live a healthy life after taking Ayurvedic medicine doses for some time. Are you getting my point? Their mode of action is slow, but it is not necessary for you to take this medicine till your death. That is, the medicines are not actually the chronic, that is your medicines are acute. Ayurvedic medicines are acute. It means that you can actually stop to take Ayurvedic medicine after you start to feel rest. Okay, but allopathic medicines are chronic. You have to take allopathic medicine till your death. Okay, so it's the difference between MBBS and BAMS. Now, as I had already told you, society always treat BAMS as an inferior degree as compared to MBBS, but it's wrong. Don't try to decide your future because of people's thinking. Okay, I know that MBBS is very important in today's world, but it doesn't mean that other medical courses have no value. I can say that other medical courses are slightly at lower level as compared to MBBS, but it doesn't mean that the students pursuing those courses are bad, dull, and they have no capability to do anything. It's wrong thing. It's absolutely wrong. If a particular student is not taking MBBS, it doesn't mean that he had scored bad marks, because you come to know the cutoff for government MBBS is too much high, but the marks he had obtained are also not bad. These are also good. If you are scoring above 550, then it is also a very good mark, because if you calculate the percentage, then these are about 75 to 80%. That is, the student scoring 550 or above 550, then the percentage that he obtained is actually lying in between 75 to 80. So these are also not bad students, because it requires tremendous amount of hard work to score even 75 to 80% in the competitive examination, especially in NEET. So I will suggest you that if you are not getting a government medical seat for MBBS, and if you are from the state Rajasthan, then I will tell you, please listen, because I know that there are only government medical colleges in Rajasthan. There is no any control of state government or the central government on the private medical seats on this state. Therefore, I can say that for those students, if you had already taken many drops, but even though you are unable to score good marks, then don't worry students, you are working hard. Don't worry, I know that it is because of your geographical location. Geographical location is killing you because of too much competition in Rajasthan. As you come to know that the students move for doing other courses in spite, against their will, against their wish. Okay, don't worry, don't feel BAMS as a bad degree. I am actually telling all those things exclusively to the student in Rajasthan, because there is no any semi-government institution for MBBS, or you can say there are only private colleges there along with government colleges. But due to the high cutoff for government MBBS, there are many students who can't able to do MBBS. So for those students, you can either take drop, but if you had already taken a drop, then don't worry, move for other options. Okay, because these are also very good choices. I am actually telling you to do so because there are no semi-government institutions or private colleges in Rajasthan. Yes, I know that there are private colleges, but these are also limited in number, and annual fees for those private colleges is also very high. And as a middle class student, I also belong from middle class family. I know that the difficulties that middle class students suffer from. So don't worry about anything. I can understand your pain, I can understand your agony, I can understand that which feelings are coming at this time in your mind. But don't worry student, it's your life, you have to handle your life on your own. There will be no anybody who will come in order to manage your life except your parents. So don't worry, respect parents, and please go forward for doing your best. Don't worry, BAMS is also a very good opportunity, because you have to become a doctor. You didn't feel that I have to become a MBBS doctor. You always say I have to become a doctor. When you were small, you always used to say that I have to become a doctor in future. So on doing MBBS also, you are using the prefix doctor before your main name. After doing other courses like BAMS and BHMS, you are also using the same prefix. So there is no such difference now. Okay, because you are becoming a doctor after doing MBBS as well as after doing BAMS also. So what's the difference? Tell me. Yes, I can say that there is a difference between the modes of treatment, but don't worry about that. BAMS has its own beauty, MBBS has its own beauty. It is not necessary for you to compare their mode of treatments. Okay, I like BAMS, I also like MBBS. I treat both these two equal. It doesn't mean that I am uh, people of different mindset, but it's true. Really, it is necessary for you to give respect to BMS also. I am not talking about peoples, I am talking about students only. Those students who are on borderline and are not getting MBBS this year, don't worry, move for BAMS. Now, it is very important thing. In the same video, I am going to discuss in detail about most important thing, and I will discuss on that topic, don't worry. Now in this video I will tell you the information about the different fields. I will tell you some merits as well as demerits of different fields. So if I tell demerit about particular field, then don't blame me, because I always respect each and every field, and I always respect the student from each and every category. So it doesn't mean that I am disrespecting them. No, I always respect to all those people, so don't worry. So as I had already told you, one of the most important thing, that if generally what happens in society, when we didn't get MBBS, then we move for doing BDS, because most of the peoples give a suggestion to do BDS. Okay, but according to me, BAMS is better than BDS. Again, I am telling, I am not actually making those students which are actually doing BDS that they are fool, they are mad. No, I am not disrespecting BDS, but according to my opinion, obviously you come to know that in Constitution of India there is written that each and every person of India, each and every Indian citizen have a right to express. There is a freedom to speech. Therefore, I am using this criteria in order to tell my personal opinion, but don't take this all opinion on your mind. For example, there may be many BDS student who will listen my video and they will feel bad. No, don't feel bad, because it's my own opinion, and I know that the such opinions may be in your mind or may not be in your mind. So it's your choice, so don't worry about that. So if you didn't get MBBS in government medical college, then the society suggests you to do BDS. But according to me, BAMS is a better option or better choice than BDS. Why? I will explain you. BDS stand for Bachelor of Dental Surgery. BAMS stand for Bachelor of Ayurveda and your surgery, or you can say Bachelor in Ayurveda and surgery. So now you must remember that in BDS we have to only do treatment in a restricted area. That is, there is only mouth region which you will treat. You will actually fail to have an opportunity to treat other body parts. It's a drawback of BDS, because in BDS you have to only treat your oral cavity, you have to only treat all those diseases which are related to the buccal cavity and teeth, and up to more extent the tongue. But other body parts are not included in the treatment of BDS. Therefore, I feel BDS slightly a very bad choice than BAMS, because in BAMS I can say that you have to treat whole body like MBBS. But the difference, as I had already told you, BAMS exclusively depend upon Ayurvedic technique, also called primitive technique, and MBBS actually depends upon the use of modern machines and allopathy practice. So if you are confused that what we have to do rather than MBBS, then please move for BAMS. It's my opinion, because as I already told you that in BDS you have to only treat oral cavity. In BAMS you will have a chance in future to treat any part of body, and hence it is to be remembered. It is the first point. Second point, if there is no dentist in your family and you are the first dentist, then what will happen? Please listen me. If you are from middle class family and there is no any dentist in your home, for example, there is no your father or mother as a dentist, that is, they do not work both as a dentist, then what you have to do, you have to don't choose this field. Why? Because the treatment that you will give to the patient, if you are a dentist, will be exclusively dependent upon the use of machines, and those machines are too much expensive. That is, you will require too much expenditure in order to set up your own hospital as a BDS doctor, because in BDS you will require many machines, and obviously as you come to know that those machines are too much expensive, and hence you will require more expenditure there, and you will require more fund to be deposited there. And as I had already told you, if you are a middle class family student, then it will be not found to be affordable for you, so you can move for BAMS. Okay, Now there are students who score in between 200 to 300. Obviously, what can I say to those students? You have not done hard work, really. If you are not crossing 300 and 400, then you have not done hard work. Give you a one chance. If you are not interested in becoming a dropper, or if you are not interested in order to take another chance, then don't worry about anything. Move for BHMS, Bachelor of Homeopathy and Surgery, because BAMS is also impossible for you to got a government medical seat, because the students scoring in between 450 and 500 can get government medical seat for BAMS. But if you score in between 200 and 300, then the only choice with which you left with is BHMS, that is Bachelor of Homeopathy and Surgery. So go and do BHMS. If you are scoring less than 200, then you have no any choice. You can join Deemed University, or if you are a middle class family student and you are scoring this mark, then you can go for BSc Nursing. Okay, but I am again telling you that I am not disrespecting any of the above field. All the fields are equal, but yes, you can say that there are different career opportunities which are specific to the specific fields. So please remember that particular thing. So this video was all about the comparison between MBBS, BAMS, BHMS, veterinary, as well as BSc Nursing. Okay, now the last point of this video, that is we have reached at a last of this video, and it is nothing but what are the career opportunities after the completion of BAMS. So once you have completed BAMS, you have to actually do any specialization, that is you have to do MD. Why? Because plain MBBS has also no value nowadays. In the same way, if you are doing BAMS, so please complete the whole degree and please achieve mastery, or please do MD there, because then only you can get any post. Okay, you come to know that nowadays the government are in work to increase the number of seats in government sector for BMS doctor, but since there is restriction in their increase, so if you don't got government job, don't worry, you can be a good lecturer in the government BMS college, and the package of a government BMS college BMS lecturer is actually in between 90,000 to 1 lakh. So you can earn good amount by joining a lecturer post in the government BAMS college or government Ayurvedic college. In the same way, the next point is to be remember, that is nothing but the you can become a medical officer. Okay, because it's a very good post. Yes, medical officer is a post in the government sector, so you can get such service. In the same way, you can also open your private clinic. Okay, now obviously you will feel certain things here on opening up your own private hospital, because it's very difficult for a MBBS doctor also to open his clinic. So as a BMS doctor, it will be also found to be challenging task for you. But I will tell you that first please earn money by becoming a medical officer or lecturer, then you can set your own hospital, or you can also go in the public hospital and there you can work as an excellent BMS doctor. So these are the some important career opportunities that you will get after the BMS. So thank you everybody. You can subscribe my channel and please view other videos. Thank you so much. Bye, and don't forget to subscribe my channel. Bye bye. See you later.